Hi, my name is Yomi Oloko. I'm actually retired now, but I used to be a social worker in the UK and a community development worker in Nigeria. Well, I'm still a community development worker in Nigeria. So my involvement in working is mainly as a work as a practitioner in mental health, and I've been doing that for decades now. I mainly did it in the UK as a social worker, mental health practitioner, and I worked there till about 10 years ago. So although I haven't directly worked with patients over the past decade, I've worked with quite a number of patients with schizophrenia in the UK, and I have quite a lot of experience about working with them, particularly engaging them into the community, because we used to work, be settling them from mental health institutions, health institutions, and working with them in the community, because quite a lot of people with schizophrenia are harmless, they're not dangerous, and they can actually cope very well in the community if they have the support. I would just say my general observations of working with people with schizophrenia, and as I said, I worked with them over decades. Number one, they are not dangerous. That belief that they're dangerous, actually, the ones I've worked with are more at danger with us, people that feel that we are in quote normal, because they are liable to be abused, misused, etc. The other thing I feel is that one of the features of people suffering from schizophrenia is that they hallucinate and they hear voices. And a lot of people, not just Nigerians, even abroad, are very, how would I say, can discriminate when someone says, "Oh, I hear voices." And to be honest, most of us hear voices in one form or the other. But obviously, people with schizophrenia hear voices, and it's easy to work with them. You just ask them, what are their voices telling them to do? Do they want to do it? How can they reply to the voices? So they're actually very easy to work with around that. The other thing I would say I've learned from my experience of working with people with schizophrenia is that it's a hard mental health illness to diagnose in the first place. And in Nigeria, because don't even have lots of mental health institutions, I feel a lot of people with schizophrenia won't be diagnosed. It is difficult to diagnose. It's not an easy mental health illness to say this person has schizophrenia. Foremost, whether we like it or not, 1 in 4 of us at any point in our life will experience a mental health issue. Most commonly depression and anxiety, not schizophrenia, but there will be some people who suffering with schizophrenia. Schizophrenia is a serious mental health issue, but it's easy to support people with schizophrenia in the community, mainly by direct support, one-to-one support, and ensuring people are using medication. The problem in Nigeria is that we have very few mental health hospitals. So many of us are going to experience mental health, either directly or within our own family. So we need to learn to know that to begin to have these discussions, open discussions, and not have them secretly. If any of your family members are being impacted by mental health, learn about it. There's lots of basic information on Google how you can compassionately help people. Listen more, and also work with primary healthcare centers, about general hospitals that do have mental health facilities. And one of the things I would really, really say, we need to stop locking up our relatives who have mental health issues. Locking them up is wicked. It doesn't solve anything. It's not compassionate, and really, um, nobody gains from that. So we need to have a more compassionate approach to how we work, how we engage with people in the community that are being affected by mental health.